Today, I want to talk about tennis elbow, also known as lateral epicondylitis. Hello, this is Dr. Siddharth Dambar from Chicago Arthritis and Regenerative Medicine. Today, I want to talk about tennis elbow, also known as lateral epicondylitis. This is a common overuse injury that causes pain on the outer part of your elbow. Now, despite its name, tennis elbow doesn't just affect tennis players. It can happen to anyone who repeatedly uses their hands and arms for work or daily tasks. In this video, we'll cover what tennis elbow is, its causes, symptoms, and most importantly, how you can treat it without surgery. Tennis elbow happens when you overuse the muscles in your forearm that extend your wrist. These muscles start at the outer part of your elbow, and overusing them can lead to tiny tears in the tendons where they attach to the elbow. This overuse can result from repetitive motions like swinging a racket, using tools, typing, or lifting objects. The repeated stress eventually leads to inflammation, causing pain and discomfort in the outer elbow. The most common symptom of tennis elbow is pain and tenderness on the outer part of your elbow. That pain can radiate down the forearm as well. You might notice weakness in your forearm or pain when gripping something like a coffee mug or doorknob. Lifting or bending your arm can become difficult, and the pain often gets worse over time if left untreated. While anyone can get tennis elbow, it's more common in active people. Those at a higher risk include people with jobs or hobbies that involve repetitive arm and wrist motions, athletes like tennis players or golfers, as well as professionals like plumbers, painters, or carpenters are more likely to develop tennis elbow. I also occasionally see new mothers develop this due to carrying and lifting their growing child. Also, during the pandemic, amongst weekend warriors, I saw a lot of folks with tennis elbow who had started doing pull-ups frequently to stay healthy. The extra stress in the elbow was causing tennis elbow. Diagnosing tennis elbow involves looking at your symptoms and doing a physical examination. I will check for pain and tenderness on the outer part of the elbow and assess how your arm moves. In particular, testing the elbow by resisting your wrist and extension will elicit pain if you've got tennis elbow. In addition to a physical exam, we also use ultrasound imaging to evaluate the common extensor tendon at the elbow and the underlying ligaments. This allows us to get a detailed look at the injured area and confirm any tendon damage or inflammation. If you're experiencing early symptoms, self-care can help. This includes resting the affected area, applying ice, and taking over-the-counter anti-inflammatory medications. But remember, ignoring the pain and continuing the activity that is causing it can make the injury worse. The good news is that most cases of tennis elbow can be treated without surgery. Physical therapy is one of the most effective ways to treat tennis elbow. A key component of physical therapy is progressive eccentric exercises where your muscles lengthen while under tension. These exercises specifically target the muscles that extend your wrist and help strengthen the damaged tendons by gradually rebuilding them. Over time, they can reduce pain and improve function. In addition to physical therapy, you can modify your activities to reduce strain, and wearing a brace or strap can help relieve pressure on the tendon as well. For more advanced cases, regenerative medicine offers excellent options. These treatments include prolotherapy and platelet-rich plasma injections, which utilize your own cells to promote healing and repair the damaged tendon. We also offer bone marrow concentrate therapy, which has a high concentration of your body's own stem cells. This can be especially effective in treating damaged tendons and restoring function. Another highly effective non-surgical treatment is shockwave therapy. This involves applying sound waves to the affected area to increase blood flow, stimulate healing, and reduce pain. In general, if your tennis elbow is not healing adequately with physical therapy, PRP or platelet-rich plasma is my preferred next step in treatment. By strengthening the tendon and the underlying ligaments, progressive reduction in inflammation and improvement in instability will occur, resulting in less pain and improved function. Surgery for tennis elbow is rarely needed. It's typically only considered if you've tried non-surgical treatments for 6 to 12 months without improvement. The earlier you start non-surgical treatment, the better your chances of avoiding surgery altogether. To prevent tennis elbow, take regular breaks during repetitive tasks, that involve your hands or arms. Stretching and strengthening your forearm muscles can also make a big difference. Whenever possible, use ergonomic tools and proper techniques to reduce strain during activities. In summary, tennis elbow can be painful, but early diagnosis and treatment are key to preventing it from getting worse. If you're experiencing any persistent elbow pain, I recommend seeking a personalized treatment plan that fits your activity level and goals. At Chicago Arthritis, we specialize in non-surgical treatments for tennis elbow and other musculoskeletal conditions, including utilizing regenerative medicine treatments. If you'd like to learn more or schedule an appointment, reach out to us today. Thank you for watching. Give us a like and subscribe to the channel. Until we connect again, have a good day and live well.